Neck and shoulder pain are common issues that affect people of all ages. Whether caused by poor posture, stress, injuries, or sedentary lifestyles, these aches can significantly impact daily life. Fortunately, there are many ways to relieve discomfort and prevent the pain from becoming chronic. 1. Stretching and mobility exercises. One of the most effective ways to address neck and shoulder pain is through stretching and mobility exercises. Gentle stretches help relieve muscle tension, improve flexibility, and prevent stiffness. For instance, neck tilts, where you slowly tilt your head toward one shoulder, and shoulder rolls, which involve rotating your shoulders forward and backward, are simple exercises that can relax tight muscles. Chin tucks, which stretch the neck, and doorway stretches, which open the chest and shoulders, are also useful. Performing these exercises regularly not only alleviates existing pain, but also prevents future discomfort. 2. Heat and cold therapy. Heat and cold therapy are effective for managing pain as well. A cold compress can reduce inflammation, especially after acute injuries, while heat therapy increases blood flow and relaxes tight muscles. Applying ice packs for 15 to 20 minutes or using a heating pad can bring quick relief. Alternating between heat and cold treatments is another strategy that can improve effectiveness, particularly for persistent soreness. 3. Massage therapy. Massage therapy offers additional relief by improving circulation and easing muscle stiffness. Professional massage therapists can target specific problem areas, but self-massage techniques are also helpful. Rolling a tennis ball over sore muscles or using your fingers to apply gentle circular pressure to tight areas in the neck and shoulders can provide immediate relaxation. Adding essential oils such as lavender or eucalyptus during massages can enhance the soothing effects. 4. Correcting posture. Poor posture is a major cause of neck and shoulder pain, particularly among individuals who spend long hours sitting at desks or using electronic devices. Maintaining an ergonomic setup is essential. Your computer screen should be at eye level, and your chair should support your lower back. Additionally, taking frequent breaks to stretch every 30 minutes can prevent stiffness from setting in. Even during sleep, using supportive pillows that align with the natural curve of the neck can reduce the likelihood of waking up with pain. 5. Mind-body practices. Mind-body practices like yoga, tai chi, and meditation are excellent ways to promote relaxation and manage pain. Yoga poses such as child's pose and cat-cow stretch the neck and shoulders gently, while tai chi focuses on fluid movements that ease muscle tension. Meditation reduces stress, which is often linked to muscle tightness in the neck and shoulders. These practices not only relieve physical discomfort, but also improve mental well-being, creating a holistic approach to health. 6. Topical creams and natural remedies. Topical creams and natural remedies can complement other treatments. Arnica gel is known for its anti-inflammatory properties, while capsaicin cream, derived from chili peppers, helps numb pain by blocking pain signals. Essential oils like peppermint or lavender can be massaged into the skin to provide relief. These natural options are great alternatives for those looking to avoid over-the-counter medications. 7. Over-the-counter pain relievers. Over-the-counter pain relievers like ibuprofen or acetaminophen can provide temporary relief, especially in cases of acute pain. However, they should not be relied upon long-term, as addressing the root causes of pain through lifestyle changes is more effective in the long run. Chronic use of painkillers may also have unwanted side effects, making it essential to explore sustainable remedies. 8. Stress management techniques. Stress is a significant factor in neck and shoulder pain, as emotional tension often leads to tightness in muscles, especially in the upper body. Managing stress effectively can play a pivotal role in both alleviating and preventing pain. When we experience stress, our muscles tend to contract, resulting in stiffness, particularly in the neck, shoulders, and back. Techniques that promote relaxation and calmness can break this cycle and offer lasting relief. Deep breathing exercises are a simple yet powerful way to activate the body's relaxation response. To practice, inhale deeply through your nose for about 4 seconds, hold your breath for 4 seconds, and exhale slowly through your mouth for 6 to 8 seconds. This method helps calm the nervous system, reduces muscle tension, and improves circulation to sore areas. Another useful technique is progressive muscle relaxation, which involves tensing and then releasing each muscle group in the body. Starting with the toes and working up to the neck and shoulders can help release stored tension throughout the body. Engaging in hobbies or creative activities such as journaling, drawing, or gardening can also shift focus away from stressors and promote a state of relaxation. Practices like mindfulness meditation are particularly effective as they encourage individuals to remain present and release anxious thoughts that contribute to physical discomfort. Reducing emotional stress not only alleviates pain in the short term, but also prevents chronic tension from developing into long-term issues. 9. Physical therapy. When neck and shoulder pain becomes persistent or significantly restricts movement, consulting a physical therapist can be essential. Physical therapists specialize in identifying the root causes of musculoskeletal pain and creating personalized treatment plans to restore function and mobility. A therapist will typically begin with a detailed assessment to understand which muscles or joints are affected and whether poor posture, injury, or repetitive strain is contributing to the discomfort. A tailored exercise program will often focus on strengthening weak muscles, especially in the neck, upper back, and shoulders, while improving flexibility to prevent stiffness. For example, exercises targeting the trapezius and scapular muscles help support better posture and reduce pressure on the neck. Manual therapy techniques, such as trigger point release or myofascial release, can also be employed by the therapist to reduce tension and release muscle knots. In addition to exercises, physical therapists may offer guidance on ergonomic improvements to daily activities. Adjusting your work environment, ensuring proper posture during tasks, and learning how to move efficiently can prevent the recurrence of pain. Physical therapy not only alleviates current discomfort, but also empowers individuals with the knowledge and tools to manage and prevent future pain episodes. 10. Acupuncture and chiropractic care. Alternative therapies like acupuncture and chiropractic care can also be beneficial. Acupuncture involves inserting fine needles into specific points on the body to stimulate healing and reduce pain. Chiropractic adjustments, on the other hand, realign the spine and joints to relieve pressure on the neck and shoulders. These therapies are particularly useful for people with chronic or recurring pain. 11. Lifestyle adjustments for prevention. Finally, making lifestyle adjustments is crucial for long-term pain prevention. Regular exercise, such as swimming or walking, keeps muscles strong and flexible, reducing the likelihood of injuries. Staying hydrated and following a balanced diet helps maintain healthy muscles and prevents inflammation. Getting adequate restorative sleep is equally important, as poor sleep quality can worsen muscle pain and slow recovery. Try these methods to relieve neck and shoulder pain. If you find this video helpful, please like, share, and subscribe to the channel to stay updated on future videos.